Hello world and hello Philippines, this is Gina Taylor's vlog and welcome back to my YouTube channel. Guys, for today's vlog it's all about dementia. My father, who passed away in June of 2020, suffered from dementia during the last year of his life. The illness made caring for him during this time very difficult and distressing for my brother and his family, who were his primary caregivers. It is for this reason I have made this vlog, in the hope it may help in some small way anyone in a similar situation. Rapidly progressive dementia. Dementia occurring quickly, usually over a few weeks or months, sometimes over 2 or 3 years, is known as rapidly progressive dementia, RPD. This can be difficult to diagnose, and is not common. Dementia can often take many years to become apparent. Some causes of RPD can be treated if diagnosed early enough and accurately. Dementia is not Alzheimer disease, as there can be many other causes of dementia. However, Alzheimer disease is the main cause of dementia, and at present cannot be cured. Other causes include head trauma, infection, heavy metal toxicity, Huntington's and Parkinson's disease, and even toxicity from medications. Many of the causes of dementia cannot be cured, although sometimes the symptoms can be treated to make the person more comfortable and improve their life somewhat. Common causes of dementia. The most common cause of dementia is Alzheimer's disease, which usually occurs after the age of 60. Vascular dementia is the second most common cause and is the result of cardiovascular problems, commonly strokes. Huntington's disease, which is a genetic disorder, can be passed from parent to child, can cause dementia. A parent with Huntington's disease has a 50% chance of passing the gene to a child. Diabetes, smoking and heavy alcohol use can be factors in cardiovascular disease, which can cause dementia. High levels of the bad cholesterol, LDL, would seem to increase the risk of vascular dementia. There are many types and causes of dementia. Doctors can ascertain the cause and type by asking questions and doing tests. Although many of the causes of dementia cannot be treated, the symptoms can sometimes be alleviated by medication, making life easier for the sufferer and their caregivers, often the family. What is dementia? Dementia is the name used to describe a loss of memory, thinking ability, language and problem solving, when it is bad enough to make decision making and daily life difficult. We can all forget things from time to time, but when it continues to get worse, it may mean you have dementia. Losing your mental abilities usually gets worse over time. How long differs from one person to another. Sometimes it can happen slowly over a number of years, other times it can happen within weeks or months. Usually it happens as we get older, but not everyone will suffer from dementia. Some dementia symptoms. Signs of dementia can show in some of the following ways. Loss of memory, where a person is unsure of time, where they are or who other people are. They unknowingly forget where they put things, get easily confused and getting lost in places they are acquainted with, forgetting how to get home. He or she may be unable to do things or solve problems they have previously done with ease. Their movements may be unsteady, and have difficulty with simple tasks. They might seem depressed, moody, or lose interest in the things they used to get pleasure from, hobbies or pastimes. Inability to sleep and agitation, along with paranoia and aimless wandering, can occur. Their personality can change and they can behave in totally uncharacteristic ways for them. Usually dementia occurs in the elderly, over 60 to 65, but can and does occur in younger people, but not often. This may be due to the body's aging, and its immune and repair systems being weaker with age. Caring for a family member with dementia. Sometimes dementia sufferers seem to remain at the same level, neither getting better or worse. They can then suddenly get much worse, very quickly. It is important to keep note of their condition. The more you are aware of their current condition, the better you will be able to look after their safety. People with dementia can get stressed and anxious if there is a lot of clutter around them. Try to keep the area around them clear of clutter, this can help them relax. They will be less likely to move around and possibly hurt themselves. For your own benefit and the safety of the dementia sufferer, limit which areas of the home are accessible to them. Many sufferers can wander off and get lost, or harm themselves, as the dementia gets worse. Try to keep them in an area where there is always a way of maintaining vigilance over them. Keep medicines, tools, cutlery and anything which can harm them out of reach, where they cannot access them. Caring for a parent with dementia can be traumatic. Your parent may be back to their early years in their mind, and start talking as if they were still there. Just be patient and let them talk away. To interrupt and try to correct them will only cause agitation to them. Your parent will have good days and times, and bad days and times. You just have to accept that the symptoms can only get worse, and treasure the good days and times. Dementia is more than memory loss. Although memory loss is a prominent symptom of dementia, there can be personality changes as well. These can take the form of paranoid delusions, of family and friends talking or plotting against them, mistrust of people and sometimes delusions. During the latter stages of most dementia types, the sufferer cannot take care of themselves, whether it be dressing themselves, or their toilet needs. They may also be unable to recognize anyone, talk or move around. Their toilet needs can become distressing for both you and them. They can mess themselves, and their living area, meaning that they and their living area requires a lot of cleaning. Caring for a parent with dementia can be very stressful for both parent and family. You cannot have reasonable discussions or talks with your parent as their memory and reason are not capable of understanding what is being said. There may be times when your parent is lucid and seems to be improving, however it will not last long. Any lucid periods will go as quickly as they may arrive. Patience and understanding are required as your parent will not understand what is being said and will forget very quickly. You may ask them to do something or agree to something and repeat it many times, but they won't remember because of the illness. Do not expect to get logical answers to any questions you may ask of them. It is better not to ask the question. They will only get upset trying to answer you, as the words may not come to them. You will get frustrated, annoyed and even angry. You are only human. Forgive yourself and your parent. To end with, I sincerely hope none of you and your families find yourselves having to cope with this type of situation. Thank you for watching. Don't forget to like, share and subscribe. And click the notification bell so you guys are updated for my new uploads.